nutrition, and today we will be discussing 5 important one-liners for your upcoming NEET PG and ini-cet exam. Okay, so let's begin with the first one. What is the mechanism of action of mevoglurant? And you see, look at the options, students. First is mTOR inhibitor, next is mGlur5 inhibitor, SGLT2 inhibitor, and the last one is dopaminergic agonist. So can you tell me some examples of mTOR inhibitor? Yes, this is everolimus and sirolimus. Okay, and this is used in treatment of tuberous sclerosis. And mGlur5 inhibitor is mevoglurant, that is given in your question, and dipraglurant. Okay, and this is used in treatment of fragile X syndrome. Clear? This is a new drug, so high chance of getting this as a question in your NEET PG exam. Okay, and SGLT2 inhibitor, all of you are knowing, this is used in treatment of type 2 diabetes mellitus. And dopaminergic agonist, the example is methylphenidate. Okay, used in treatment of ADHD. Clear? So let's move on to the next question of the day. So this is, as you can see, what is the osmolarity of cereal based F75? Okay, so if you have done my SAM class, rather severe acute malnutrition, I have told you in details regarding F75. Okay, when it is used, how to use. Okay, so F75 are basically of two types. One is cereal based and the other one is milk based. Okay, so the osmolarity of cereal based is obviously expected to be lower than that of milk based. So this is 334 and that of milk based is 413. Okay, so the options are 245. 245 is osmolarity of low osmolar ORS, as all of you are knowing. 334 is osmolarity of cereal based F75. 413 is milk based, as I already mentioned, and 419 is the osmolarity of F100 formula. Clear? Now, so here the answer will be option B. Okay, so now moving on to the third one liner, that is, what is the biochemical changes in anorexia nervosa? So you see the options may be appearing to you a bit confusing: metabolic alkalosis, metabolic acidosis, hyperglycemia, hyperkalemia. So in anorexia nervosa, what happens is there is hypochloremic, hypokalemic, metabolic alkalosis. Okay, and along with that you tend to get a low WBC count. Okay, low gonadotropin levels. Okay, so here the option is option A, metabolic alkalosis. Clear? Now moving on to the fourth one liner of the day. So you see, what is the structural MRI brain finding of an autistic child? Okay, so I know if you see this question, definitely you will tend to mark option A, that is reduced volume of frontal lobe. So this is basically once again a very confusing one. Here it's a contradictory one. The answer will be overall increase in brain size, which I know none of you will mark it correct. Reduced volume of frontal lobe generally doesn't happen in autistic child. Increased lateral ventricle volume, this you find in a case of schizophrenia. Okay, overall increase in brain, as I told you, in autism. And smaller size of prefrontal cortex and basal ganglia, this you find in a child with ADHD. Okay, so here answer is option C, overall increase in brain size. Remember this. Okay, now moving on to the last one liner of the day. So cherry red skin is seen in which type of poisoning? So this is basically a direct one liner. Here this is carbon monoxide poisoning. Okay, in nitrate poisoning the color will be bluish, and in arsenic poisoning the color will be silver black. Okay, so hope this was useful, student, and of course do subscribe my channel if you haven't done yet. So we'll be meeting soon again. Thank you.